Welcome back, and we return to the issue of Caster Semenya and the IAAF's new rules regarding athletes with high testosterone levels. As we said earlier, we're joined now on the line from Berlin by Dr. Frank Montgomery, who is the chairman of the World Medical Association. Dr. Montgomery, thank you very much for joining us this morning. The statement from the WMA says that what the IAAF is asking doctors to do is contrary to medical ethics. Can you explain that?
Well, you definitely know that it's unethical to dope patients or to dope athletes to enhance their performance. At the same time, it is also unethical to deliver drugs to a patient simply to enhance or modulate his or her performance. This should be only done for medical reasons, but not as a prerequisite for gender testing. So we say it's unethical for doctors to do this type of what I call inverse doping. It is just similar to doping and should be forbidden.
It's complicated in the 21st century, though, isn't it? Because there are two categories in athletics, male and female, and you've got to draw a line in the sand somewhere. So the IAAF has decided where they're going to draw the line, and they're asking women to do this. As a doctor, do you have an idea of how they can make their way through this quagmire?
It is very difficult, and it is not the issue of WMA to help IAAF to draw a line between man and woman. But to show you the borders of this is, we've received a letter from the IAAF Scientific Council telling us the exact genetic status of Caster Semenya. I find this is against the dignity of man, to give away the status of testes, of the chromosome testing, of all this. And I think IAAF has to reconsider their rules, because nowadays we know there is a differentiation in sexual development, and there is a third category. It is not up to us to solve their problem, but they should definitely respect the dignity of man and woman, and they should respect that doctors should not prescribe medicines for anything but medical indications.
I think few people would dispute the fact that that dignity has been stamped on, and in particular Caster Semenya's dignity, all the way through this process, right, and since 2009. But you use that expression, differences in sexual development, and that in itself is, in a sense, controversial, isn't it? Because it makes it sound as though there's something wrong, whereas actually medically, on a certain level, there isn't anything wrong. It's just a difference.
There is just a difference, and there is definitely nothing seriously wrong, though, however, we must concede that in some of these cases there is a higher risk for cancer. But that is in the decision of the athlete, whether he or she has their testes removed because of this. And it has they have to feel that this is a pathological condition. But Caster Semenya feels like a woman. She has the advantage of testosterone. So it is up to the IAAF to decide whether she can start in the men's field or in the women's field, but not to ask her as a prerequisite for starting to reduce her testosterone levels medically by contraceptives drugs. And it is really, it's idiotic to give someone who doesn't have ovaries, who doesn't have a womb, who doesn't have a uterus, to give them contraceptive drugs because they are infertile anyhow.
In medical terms, when is it ethical to give the kind of drugs that the IAAF is, in a sense, asking Caster to take if she wants to compete?
It is ethical if she, well, it's never ethical if it's a prerequisite set up by someone else. If she herself has the desire and feels a certain amount of disease or sickness or pathologic finding, then it would be ethical. But to give contraceptive drugs to someone who doesn't have the receptor organs for normal contraception and doesn't need contraception, I would state is always unethical.
Have these drugs been taken by women like Caster Has any testing been done? Do they know the consequences of what taking these drugs will have?
Well, I have no idea how much involvement of Caster Semenya in telling her what could be the results of this therapy has taken place. I mean, in medicine nowadays, if we offer a patient modern technologies, modern therapies, modern drugs, we have to tell them in advance what could happen. And in countries like mine in Germany, the patient even has to sign that he has been informed. We call that informed consent. And I don't know whether this has been achieved in the case of Caster Semenya. As far as I know, she has refused to take the drug, and that is a good right, I think.
And then that creates the problem, because in effect what's happening then is the IAAF will prevent her from running. They say they're not forcing her to take anything, but the result of her not taking something will result in her not being allowed to run. So any woman like her who wants to run will be forced to sign that consent, which becomes problematic in itself, isn't it?
That is the problem, and that is what we think is unethical if a doctor then prescribes the drugs, because this is only done to enhance the possibility to start in the women's field. There is no medical indication for it.
Dr. Montgomery, in the original hearing before the Court of Arbitration for Sport in Switzerland that took place in February and that the Caster ruled on a couple of weeks ago, that is now going to be challenged in the Swiss Federal Court, there were endocrinologists on both sides of the argument, some ruling for the IAAF and some ruling in favor of Caster and Athletics South Africa. That implies to me that there's a lot of disagreement, or else the scientific research just isn't comprehensive enough yet in this field.
I absolutely agree, but I am not trying to argue scientifically. I'm trying to argue ethically, because this is not this is a big scientific debate, but it's not an ethical debate. And I think IAAF has to consider this and reformulate the rules from an ethical point of view, no matter what science says about that. And science is not our issue as World Medical Association, and it's entirely unethical to administer drugs to someone who doesn't need them.
Dr. Montgomery, as the World Medical Association, I know that you've asked your doctors not to prescribe this kind of medicine. Can you prescribe that your doctors not do this? Do you think there will be a large amount of doctors throughout the world who will refuse to issue these kind of drugs to women with these kind of issues?
Well, the question is whether you're asking the optimist or the realist in me. I mean, we have a firm point on doping, and we know doping does happen. And this is inverse doping, so of course I'm optimistic, and I say most doctors of this world will adhere to these principles. But the realist in my heart says there might be one or two who will do it. But I think Caster Semenya has the point, and she said she doesn't want to take this type of medication, and I think she's right.
On that note, Dr. Montgomery, thank you very much for your time. I do appreciate you coming into our studios in Berlin this morning. That's Dr. Frank Montgomery. He is the chairman of the World Medical Association, on the line from Germany. That